Hi, I'm Angus.
And I'm Liv, and we're physiotherapy students.
In this video, we will discuss and demonstrate the benefits of using a slide sheet when moving a patient in bed.
A slide sheet is very useful for moving a patient without straining yourself or the patient.
The material of a sliding sheet allows for very little friction, allowing for the material to slide freely across each other, making this a very simple and useful tool. When folded in half, it can move in two ways. The first and most common way is when the top layer of the slide sheet slides over the bottom layer. This makes moving a patient who is on top of the two layers quite easy. The second way is the opposite of the first. The bottom layer can slide underneath the top layer, leaving the top layer in the same position. This can be useful when adjusting the sliding sheet when a patient is on top of it. A slide sheet can be folded in different ways to make it easier to slide under the patient. The first way is to simply fold it in half and scrunch the sheet from the folded end to have half to 3/4 of the sheet in your hand. The scrunched portion is then placed under the patient at their back, who has rolled into side lying or partial side lying. Once the patient is then lying back in supine, the sheet is then pulled from the other side to be fully under the patient. The second way a sliding sheet can be folded involves a concertina folding pattern. The folded sheet is placed under the patient's hips or shoulders. When the slide sheet is placed under the shoulders, you pull it towards the feet. This means you hold the bulk of the sheet in your hand towards the head. When placing the slide sheet under the hips, you hold the bulk in the hand closest to the feet and pull the sheets towards the head and towards the feet to fully cover the buttocks. This means you pull both ways.
When moving someone on a slide sheet, it's important to grasp the sheet at the hip and the shoulder, scrunching the sheet so your hands are close to the body. For your positioning, for example, when moving someone down the bed, you would lunge towards your leg closest to the feet, moving your weight with the patient. Counting down using 1, 2, 3, slide ensures the slide happens at the same time.
Thank you for watching, and I hope you found this video informative and that it helps you mobilize patients in the future.